Hi, it's Dr. Matt Harkness with Allied Physical Therapy Wellness Community, where our mission is to get you back to what you love without surgery and without medication. Of course, it's important that you also take what we call a habit-based approach to being well, body, mind, and spirit. So this month, September, is Fall Awareness Month or Balance Prevention Month. And one interesting statistic, according to the CDC, is that 90% of visits to the emergency room are due to falls. And most falls are preventable with the right education, with the right tools, and also with some professional help at times. So a good thing to consider is to determine, are you at risk for falls? So some of the risk for falls can be weakness. It can be medication, different side effects to medicines. It can be poor vision. It can also be you're not as well able to feel your surroundings, like you might have some numbness in your feet. So those are some things that can potentially increase your risk for falls. So one dangerous thing that can happen is you can get into what we call the cycle of fear when it comes to balance. So what happens is you feel more unsteady, or maybe you have a small fall and you begin to think, I don't want to fall. So you slowly, kind of subconsciously start to reduce your activity. You reduce your walking in the community, your walking in home. You spend more time sitting. And you don't even realize it, but you are not working your muscles and joints, and as a result, you're actually becoming even more at risk for falling. So a couple things you want to consider. One is that sometimes the right tool, say a cane, maybe even a walker, or some trekking poles, would actually be good for you because it'll keep you walking instead of saying, well, I feel unsteady, so I'm just going to stay home. So someone like us, we can recommend what would be good for you. While your pride might say, I don't want to use a cane or something, but actually it may be good. Consider when you go to the grocery store or to Home Depot and you use a shopping cart and you feel secure, you feel stable, and it's great for walking around without feeling like you're going to fall. So that is kind of a stability tool that will help you with walking. Another thing to consider is what risk factors do you have at home? So maybe throw rugs, uneven surfaces. You might have a threshold with a large threshold that you could potentially trip on. Even animals sometimes, if they're scurrying around your feet, you could trip on them. So you want to take precaution to make sure that you remove those hazards or be aware when the critters are around your feet. Also, lighting actually can be a big hazard to fall. One of the biggest things that I have experienced as a clinician with patients over 20 years is that many people fall during the night and they get up and there's not good lighting and they actually fall. Also, incontinence, or as my wife, she and her team, they treat pelvic health conditions. A lot of them will treat what's called frequency, meaning you have to urinate frequently, so you're getting up several times a night, and 2, 3, 4 times a night, and that will increase your risk for falls because you're tired, you might have poor lighting. So that's another thing you want to be aware of and get taken care of. Now, it is important, if you need professional help, which I highly recommend, is that as your team of physical therapists here at Allied, what we do is we don't just look at strength. So strength is one factor that can be causing you to, for example, feel unsteady. So yes, we will work on strength, some calf raises or some legs and core exercises can be very helpful. Another thing is to look at your mind, and a lot of times you may have the strength, but you have a fear of actually getting up and moving around. And so when you come in here and there's a controlled environment and we give you that confidence that you can do this, doing different treatments or exercises, balance techniques with our guidance starts to give you that confidence and help your mind as well. The third component is actually your spirit, like meaning if you don't have a sense of purpose and you feel kind of discouraged and you have a lack of motivation, sometimes it is a matter of saying, well, what is it that you feel that really makes you have a sense of worth? And whether it's singing in the choir at church, or whether it's helping at the homeless shelter in downtown Fort Myers, those kinds of things will really help you to identify, and then that'll also help you to say, hey, I want to get moving and do better. So the good news is that even though you feel like that you are getting less mobile, maybe you are concerned that you could potentially fall, there is simple solutions, and we are here to show you some of those solutions. But first I want to talk about two areas that I have found over the years that are most common for a fall. And one is sitting down in a chair. And basically, when you sit down in a chair, you should back up and actually have the back of your knees touch the chair. Feel them back here before you sit down. And a lot of times when people they try to sit down like here, they end up falling to the ground. So that is a simple trick. The other very dangerous area that you could potentially fall is in the bathroom. And that's because it's wet in the bathroom, you can slide. So things like a grab rail, some non-skid kind of like sticky tape on the floor of the shower or the tub are very helpful. As I said before, there are some different things here in terms of the trekking poles. Sometimes they're helpful. You can use these when you're walking outside or on the beach. An adjustable cane is helpful. Now remember, when you use the cane, it should be to where your wristwatch is, so your elbow's slightly bent when you're using it. So that's a good one too. And then of course, if you have been in the hospital or had something a little more serious, you may have to use a walker. So a walker, the same as a cane, should come up to about wrist height. So again, wrist height, and then walking this way. Last but not least, I'll leave you with two simple exercises, and if you do these consistently, it will really make a difference. So the first one would be standing up and sitting down in a chair 5 times a day. Okay, so 5 repetitions once a day, that's better. And then also some ankle strengthening, going up on your heels and having your toes come up as well. So those 2 exercises are really good. And think of it again, if you do standing and sitting 5 times once a day, and you do going up on your heels and your toes 5 times once a day, for a year, it's going to make a huge difference. So last but not least, be sure to visit our website. We have multiple great resources for you, ebooks, good information about staying healthy, and you can share this video with a friend. Join our YouTube page, and I want to give a shout out to Marvin, our new wellness guide. You can't see him, but he's holding the camera for us, and we're looking forward to improving and enhancing the quality of these videos each month.